105.1 The Buzz. I am Sheryl, and I'm joined by Dr. Workman. I am so glad you're here. There's a story I've been dying to ask you about all week.
Look out.
Well, I mean, you would probably know if this is true or, you know, the media blowing this up. But I read a story that younger and younger people are getting wrinkles. They're calling this text neck because of people looking down at their phones and texting and being on Facebook and Snapchat, whatever, that younger and younger people are getting wrinkles in their neck and seeking cosmetic procedures. Is that true? And is there something that can be done about text neck?
Well, it is potentially true. I think anytime you have the face in a position where you create wrinkles, you can form wrinkles. There is a treatment called Thermage, which has been shown to, I mean, basically we heat up we superheat the skin, and it basically makes the collagen become much more youthful. And so it's helpful that way. Normally, we don't do it a lot in teenagers or 20-somethings. I think much more frequently what people complain about is they have extra fat in their chin, and we're seeing what we call the submental chin deposits. Typically you keep your iPhone below your eyes. You're looking down, and you kind of you look your worst. And what I tell patients, put that iPhone up a little bit higher. Put your chin up a little higher and stick out your chin from your from your neck, excuse me. And that'll give you, that oftentimes for a lot of people gives us a much more aesthetic appearance.
Sure. It's all about the angles and the lighting for the selfies, but sometimes even the angle can't help, especially with that chin area.
Yep, absolutely.
Now, you were mentioning a couple of minutes ago about a double chin area.
Yeah.
And what can be, I imagine there are several approaches to take depending on the size of it, the shape of it.
Correct.
What is the first line of treatment when someone comes in and they're like, you know what, I'm just not happy with my profile.
Yep.
What can we do about this?
Yeah, oftentimes people that really aren't happy with their profile, it's due to they have more fat cells that are just in that, we call it the submental area, but it's the area just below the chin. And oftentimes just by going in and either doing liposuction, or one of the latest things that was just approved by the FDA is called CoolSculpt, we're able to reduce and permanently kill the fat cells that are in that area.
And you were saying that they just approved it for use on the inner knee?
Yep, the FDA just has approved a new applicator just for the inner knee. And when I evaluate someone for leg liposuction, basically there are three areas where women carry their fat. Right in between the legs, kind of the medial thighs. Oftentimes they'll touch, together. The other area is the saddlebags. Oftentimes women, they just a little extra fat outside that hip. The third area that most women have, and some of them aren't even aware of it, is fat in between the knees. And this new applicator is really good for dealing with that. You can do that in 35 minutes without going to sleep. You go back to work that day.
Wow, that is fantastic. And if you want to find out more about CoolSculpting, you can go to Dr. Workman's website. And I recommend that you do that this month because you're running a special right now on CoolSculpting for the month of April.
I think we are, yeah.
So go to drmichaelworkman.com. You can find out more about everything that Dr. Michael Workman does to make you look your best. Lots of different treatments for lots of different issues that you may have. And once again, that special on CoolSculpting during the month of April, drmichaelworkman.com. Thanks for coming in.